there will be an impact in the brain development. Because when a child is being neglected, there's a lot of stress going on, and it can release some stress hormones, for example, like cortisol, and that will affect the child's developing brain and also certain circuits in the brain. In fact, there are also research that show that the brain of the neglected child can even be smaller compared to normal children. So neglect definitely will impact a child's cognitive development. Specifically, the certain parts of the brain that is affected is usually the ones that is impaired in the learning and the memory. For example, like the hippocampus, the amygdala, and the prefrontal cortex. So these parts of the brain are very, very important, especially in the cognitive performance of the child. Which means they are lack in certain skills that can help them in coping with stress and becoming a strong person and a resilient person. So definitely it will have an impact in the patient's mental health, because studies have shown that they have an increased risk of certain psychiatric illnesses. Definitely, yes, there's a lot of behavioral issues in children who are being neglected. And the children who are being neglected, they are somehow more hostile and they have aggressive behavior. And as an adolescent, they can also have certain personality disorders. Research has shown that the children who were neglected or being abused before as a child, they have a higher risk to become an abuser. Out of these children, maybe about a third of them will turn into a parent who abused children as well. Early intervention will have a better long-term outcome in terms of educational achievement, lifelong health, as well as the patient's successful parenting in future. From that, there's also involvement of the JKM or the social service, in which the JKM or the social service needs to make frequent visits to the child when the child after the child has been sent to foster care or other homes. So the social visits needs to be there as well to ensure that the child is being cared for and is in a safe environment.